nursing documentation is probably one of the bedrocks of looking at any patient. When we review data of any patient, I think so nursing documentation has been the bedrock of it. Being a doctor, I can just when I don't have any hesitation in sharing that sometimes the doctor documentations, medical documentation is not as appropriate as nursing documentation is there. So while we discuss this, I think so today we have a stellar panel of 4 senior members from the healthcare sector. So it will be interesting to see, and we'll interact and we'll hear their opinion on what all to do going forward and on the nursing documentation as we look at it, the rational essential documentation for effective patient care. So what I'd like to say is that what is the basic purpose of documentation? The primary purpose is obviously to facilitate information flow that supports continuity, quality, and safety of the patient. And with it attendant things are always there, like accreditation, accountability, legal requirements, the financial part. But overall, the most fundamental thing is patient care. How do we plan for care? How do we hand over? How do we ensure that if you look at as time has progressed in the healthcare sector, nursing has been burdened with a lot of documentation, lot of paperwork. So I think so this it will be a good thing to sort of brainstorm on what to do and how do we reduce their paperwork and not slow the productivity. So with that, I would like to sort of start off with asking Ms. Gracy Mathai, is that how do you look at enhancing the plan of care? Because there's a lot of audience from across India, outside India also, because plan of care and handover are two very important things that we need to focus on. So on the plan of care, I would like to just invite Ms. Gracy Mathai to sort of educate the viewers who are there on what are the best things to look at on the plan of care. Over to you, ma'am.
Thank you, Dr. Panigrahi. Now, good evening, everyone. It's really the documentation when we think about today, it is the hottest subject of today, especially amongst the administrators, amongst the clinicians. They always think that when I see the nurses are always documenting, they are not at the bedside to give care to the particular patient. They have been seen always documenting. But rational documentation is very essential. And I just would like to first instance little documentation about the NABH requirement, since we all wanted that importantly. And then later part, I'll go into the plan of care, that's a best documentation. See, documentation is the only written evidence of interaction between the healthcare personnel, the patient, their family, and even all other stakeholders. This is an interaction in the written form. Now, especially healthcare documentation also can be expressed as a written communication between various healthcare workers also. Now, documentation is again a part of healthcare practice. Now, this will help the organization in overcoming various things like it ensure patient safety. Now, when you do something and you document it, what do? You are avoiding your duplication. You are not missing any important event over there. And what is required is being achieved by you when documented things are there. Now, it again protects the organization as well as the personnel from the legal hazards. It again gives a satisfaction to the employee, at the same time an organizational satisfaction also there when the documentation is there. Now, all of you will agree with me, this type of documentation even not only help the nurses to learn or to update, but at the same time, even it helps the patients also to update. Few patients told me that your discharge summary have elaborated everything in it that even I have learned much about my disease. I was not knowing till this now what is there. Hence, what has happened because of all these things, now NABH insists upon various mandatory documentation in the healthcare practice. And all of you agree with me in the form of manual, protocol, procedure, policies, work instruction, various checklists, various forms, etc. Out of all these things, what we can say, the case sheet is one of the major and very important document in the care of patient. Now, rather, I can say, or you will agree with me that case sheet is the sum total of the documentary evidence of various care and treatment given to the patient by different healthcare providers like clinician, nurses. Now, in the case of like it may be physiotherapist, it may be clinical pharmacist, your nutritionist, whoever has given care to the patient, that will be there in your case sheet. Now, what has happened? N number of documents are there in the case sheet. Before that, I'll just announce, I will come to the question which has been raised by Dr. Panigrahi. How can we have a best plan of care for our patient? See, when a patient is being brought under our care, when I say it's a nursing care, the nurse has to have an overall look, an overall assessment of the patient. Nursing assessment is very, very important. Overall assessment, or in other way, what I say, head to foot observation. And you are not just assessing mentally. No, you are assessing and you are writing down, because mentally you cannot assess and you cannot keep everything always. What do? You have to go on writing. You have to go on documenting. Maybe in future or in some of the hospital in the form of electronic, that may be easy, but at least today's generation, much of the hospital, it's a handwritten. So that go on writing what all you have observed. Based on your observation, what you will be coming to a conclusion that what can be the nursing diagnosis of this particular patient. I'm not talking about the medical diagnosis or the clinical diagnosis. What is your nursing diagnosis, what you found in this particular patient? For an example, in a COPD patient, when you look to the patient and you found that the patient is breathless, and especially you found the patient is breathless when the patient is in the lying position. So you found your diagnosis is patient is breathless at the lying position. So next step come to your plan of care is that, okay, what all measures I have to take in order to relieve the breathlessness of this particular patient. There are various measures we put into practice in our day-to-day. Why? For a breathless patient, in order to relieve the breathlessness, like propping up the position, maybe turning the position to one side to another, so or giving an additional pillow to the particular patient. So all these things are your plan which you have planned for that breathless patient. So when you plan for your patient, your planning should be based on the problem you have identified on your patient. Once your problem you have identified in your patient, you will have a proper plan, and then of course you implement that plan. You record that plan and then you are going to implement that plan. After implementation, you will evaluate and see that whether the patient's breathlessness have been reduced. 100% you will see that some reduction in the breathlessness is being observed after giving a propped up position to the patient. So what? The patient is satisfied, you are also satisfied. So the nursing care plan, when we think about, or plan of care in the best way, what we think about, plan of care has to be based on the condition of the patient, nursing diagnosis of the patient, and not only writing the plan of care alone is enough, but you have to see that that is being implemented, and at the end you have to evaluate. Just implement and go also do not happen, but you have to see that you evaluate the patient also. This is all, Dr. Panigrahi, regarding that nursing care plan, what I just would like to say. I also would like to say a few things on the nursing documentation, what we see as per the NABH requirement. Now, see, especially you think about the as soon as you receive a patient in your nursing unit, we look for the initial assessment of the patient, and we lay down various time frame. In the emergency department, what should be the time frame? In the ward, what should be the time frame? At the same time, in the ICU, what should be the different setup area we define the time frame within which what you have to see. In your nursing assessment itself, you have separate nursing assessment, initial assessment format. For OBG patient, different. For adult, different. For pediatric, below 3 years, it is different. Above 3 years, it is different. For your END and ophthalmic, it is different. So different types of nursing assessment format is there. In that, what will be there? Your system-wise findings, your vitals, your burden score, your fall risk assessment, and especially for pediatric patients, separate fall risk, and adult separate fall risk, your pain scale, that is also again numeric as well as Bonbaka, your medication reconciliation, your functional assessment, and your mobility assessment. So your nursing assessment itself is quite big, and that is required also by NABH. Then your daily nurses record, then your care plan, including your pain assessment of your patient. Then you will see that your other vital charts, your TPR, BP, intake output. When the patient is a diabetic, there will be an insulin dosage chart and various procedure record like your urinary catheterization, central line, peripheral line, pleural drainage. On this thing, what you will be doing. And of course, very important thing is your hand of communication. And very important thing is patient and family education. The NABH 5th edition as well as the Nursing Excellence Standard also expect patient and family education. None of those patient and family education point can be avoided. So you have to involve all those things. When it comes to the surgical patient, your pre-op checklist, your post-op checklist, your record in the operation theater, and the sedation checklist, what do you do? When the patient is on a restraints, your restraints care and monitoring flow of the patient. When the patient is on restraints, it goes on like your push tool, including your pressure ulcer healing chart, and all your infection control bundles like SSI, your COTI, CAPSI, all your bundles are there that you have to look into this. That again, that VTE prophylaxis that you have to look into. Antibiotic justification, if the clinicians are advising proper antibiotic, that again you have to look into. Various ICU observation form depend upon the type of ICU what you have. When I say that, there are n number of documents when our nurses are doing. Moreover, when a nurse is posted in the chemo area or a dialysis area, even their document varies like that. So the requirement of documentation is very essential, and people worried about this documentation. Why? Because especially many places documentation is done basically to show during the assessment time. It should not be. I have already told you earlier that it is going to help us in a day-to-day practice. It is going to gain the satisfaction of our patient. It is going to gain your own employee satisfaction. And moreover, and it also helps us in our patient safety. So
thank you, ma'am.
Thank you, Dr. Panigrahi.
Thank you very much.